Hello everyone. Today we'll be talking about atrial infarction. So as we are all aware that we normally talk about a myocardial infarction, and in respect to mostly we talk about the ventricular infarction, and based on that we say whether that is ST elevation MI or non-ST elevation MI, and also called as unstable angina. However, there is also an entity called as atrial infarction, and the atria is also supplied by coronary arteries. So this atria are also susceptible to various kinds of infarction, and the ECG changes what occurs in atrial infarction we all should need to be aware of. So that's why we are making a session on this atrial infarction. So right atrial infarction is more common than left atrial infarction, possibly because of that higher oxygen concentration in the left atrial blood. So left atrial blood normally contains more oxygen-rich blood, and that's why there are higher chances that this is less prone to infarction when compared to the right atrial infarction. When compared to the posterior wall or lateral walls, the atrial appendages are more susceptible to infarction. So that's why the infarction can be more commonly seen in the atrial appendages. And what is right atrial infarction? Right atrial infarction have been reported in around 81 to 98% of myocardial infarctions, and left atrial infarction is seen in 2 to 19% of infarctions, while infarction involving the both atria has been seen in 19 to 24% of infection. So what are the changes which we see in ECG is that, so ECG atrial segment is normally denoted by what is called as P or PR segment. So anything like PR segment elevation or depression in any patient with myocardial infarction. So suppose any patient to have a myocardial infarction which features of ST elevations in any of the leads. Along with that, if there is associated PR segment elevation or depression, then we label that patient that it may have a concomitant atrial ischemia. This patient with atrial ischemia are more have higher chances of risk to develop atrioventricular block, supraventricular arrhythmias, and cardiac free wall rupture. So there is a criteria which has been given by Lewis for diagnosing atrial arrhythmia. He says that infarction is labeled as atrial ischemia can be diagnosed with PR elevation of more than 0.5 millimeters. So 0.5 millimeters means nothing but if there is involvement of more than a half small square. So the ECG is there. If you can see, there is this is the large box. Each small square here is 1 millimeter. So half small square, that is more than 0.5 mm in V5 and V6 PR elevation. Along with that, if there is reciprocal PR depression in V1 and V2. So if there is elevation in V5 and V6, but with reciprocal PR depression, it is suggestive of atrial infarction. So similarly, if the PR elevation of more than 0.5 millimeter in lead 1 with reciprocal PR depression in lead 2 and 3 is also suggestive of atrial infarction. So this again PR depression. If you are to consider only PR depression, that depression should be around more than 1.5 millimeter. That is more than 1.5 small squares in the precordial leads and more than 1.2 small squares in the leads 1, 2, and 3. Along with that, abnormal PV morphology, either M shape, W shape, or irregular or notched, is comes under the minor criteria. So as you can all see here, this is the P wave. This is the PR depression. This PR depression is always talked in comparison with the TP segment, which is the isoelectric segment. So we try to compare it with the isoelectric segment. You can see here. So this is the TP segment, and if there is a PR depression is there, if it is compared with this is the isoelectric line, the T wave. This is the T wave. So TP segment, this is considered as isoelectric line or baseline. If when compared to this, if the PR is coming below that, and then it is called as concomitant PR segment depression. So this PR segment depression and PR segment elevation is also seen in pericarditis. But what is important is that in pericarditis, the elevation is concave up, whereas in MI, you can see it is convex up shape. So concave up appearance, if it is there, then it comes under pericarditis, and convex up is there, it comes under infarction. So hope you have understand this video and you have liked this video. If you want more videos like this, do subscribe to my YouTube channel, Dr. Akif Baig. Thank you.